ultra athlete, nutritionist, about being the best that you can be. Dietary wise, exercise wise, supplement wise.
Yeah, she had a lot of great information about women and their fitness in diet going through perimenopause and menopause.
Yeah.
So it was very specific. I really enjoyed her a lot, and I can see us continuing to work with her.
Yes, absolutely. Wealth of information.
Enjoy the episode.
But what do I know? I'm just a vagina doctor. Dr. Chris Latham, welcome to the Vagina Doctor podcast.
Thanks for having me.
It's great for you to be here. I just feel like you've got so much information that I want to tap into. You're a doctor of clinical nutrition, a competitive athlete, and founder of Heal Well Nutrition, evidence-based nutrition practice here in Santa Barbara. Your focus is empowering athletic women over 40 to thrive in their sports by addressing the additional symptoms that they experience at this changing time of their lives, which I am up to my neck in on a daily basis. Being a gynecologist, I see many women struggling with the pre and postmenopausal issues, and even after we resolved the hormonal things, we got everything balanced and everything seems to be okay. It's just the nutrition is something that I feel like we're not, as physicians, we're not paying enough attention to. You probably know that in medical school we have minutes of nutritional guidance and information, and so it's I think that what I was taught, now medical school is 50 years ago, and I think everything that we were taught then has been shown to be wrong, or I've forgotten it, which is still possible. So I really do expect to learn a lot from you today. So tell me more about your practice, what you do, what you're focusing on with these remarkable women, I would say, that are really striving athletes at 40 and around.
Yeah, so my main focus is, like what you said, empowering athletic women over 40, because that's myself. I was an athlete at a young age, and I get a lot of female athletes in my practice, ranging from trail running to skiers to surfers to just gym goers. Pickleball is a big one that's come up lately.
Totally.
Yeah, so dealing with all those issues, and they're all different. So I feel like a lot of it's digestive issues and also hormonal like blood sugar issues, or sometimes there might be anemia. A lot of it's absorption issues, which I think a lot of people don't realize that they have. So they're not getting the nutrients because they're not able to absorb it. So just years and decades of just built up stuff, and they don't know they have it. And then they come to me, and that's not their main symptom, say, is I'm feeling I have no energy. And so I check their blood sugar at first, see if they're anemic. So that could be iron, that could be a bunch of different things, B12, B6, folate, just making sure the mitochondria run. So they're getting enough energy, making sure their macros are correct, because athletic women or women over 40, there's 3 key issues that I see. And
what are macros?
Macros, thanks. Yeah, macronutrients, so protein, fat, and carbs.
Okay, got it.
So making sure that they're in the correct ratio for what they're doing in life.
Yeah.
The 3 things that I see, there's probably more, but the main 3 things I see are they're not eating enough, so they're eating too low carb. So which impacts your thyroid and raises cortisol, because you've got to make it, so it increases blood glucose, and so you increase your cortisol. Your cortisol stores fat and just dysregulates your hormones. They're exercising too much, or they have a lot of stress, or the big thing that I've been focusing on lately is the timing, because the timing of what to eat pre and post workout. So how to eat, how much to get in. And there's also a lot of different supplements you can take. So for instance, I have a trail runner that has osteopenia. And so she's just over-exercising. So that's that cortisol piece. Cortisol breaks down. It's catabolic and you want to be anabolic. And so that's more of the protein and the antioxidants and building up your body, not breaking it down.
That was a lot of information. So we're going to break it down.
Okay.
So when you bring up the macro, it's so subjective and not everyone is the same in how much, right? Carbs, protein, fat they need. What's your equation with that? Like if you take one of the people you work with how do you figure that out for that individual person?
So it depends on that person. It depends on if they're digesting, how's their digestive issues, how are they sleeping, what are they absorbing? Basically, it's so women, as you get older, as you hit post-menopause, your cortisol naturally increases. So it's harder to keep your blood sugar stable. So incorporating more protein, we also lose muscle mass. So more protein as you get older. And so if you're vegan or vegetarian or you're dairy free, that makes it a little more complex.
Oh yeah.
So the protein is super important, and then making sure they're getting the right carbs. So making sure they're eating enough. Gosh, I'm just thinking in my head.
Because people basically they eat, or I'd say if you're an athlete, you're watching what you eat maybe. Right?
Athletes tend to be low carb.
Right. And so then they're not eating enough and they're working out more, or they're more active. And then when you go into menopause, what shifts have you found with like blood sugar and menopause? Or we have patients that go, I'm doing what I've always done. Why is that? How do you test absorption?
So you could do, there's a lot of different tests. I could ask them, do you see food in your stool? Are you rushed when you eat? Are you completely breaking down your food? Are you
chewing it?
Are you chewing
times?
it? Yes, exactly.
Yeah.
Are you in a rush? Are you just grabbing a bar? How much coffee do you have? Do you have like 10 cups a day versus just 1 cup of coffee? Do you need to have coffee to wake up? Do you skip breakfast? That's the worst for blood sugar, skipping breakfast.
Right.
Because then you're just running on adrenaline and cortisol. And so it's going to be harder. And eventually you might lose weight in the short term, but then you'll put it on in the long run typically. It's all genetics play a role as well. I'm just thinking about the many clients that I have. And one of them I just met the other day, and she follows a really low carb paleo diet, and she's having paleo coffees, which is like MCT oil and butter, like 3 times a day.
Oh God.
And so she's just running on that fat and cortisol, and fat is good for you, but not in large amounts. So, because that affects the microbiome. And
is she like counting that as meals?
No.
Okay.
She'll skip meals and have that.
That's what I mean. Like, so she's
sometimes.
Yes.
And it depends on when you're working out. So if she works out, God, I'm so tired at the end of the day and I'm just craving sugar. And well, it's because her blood sugar is unstable. So she becomes hypoglycemic, which is low blood sugar. And then she has like a protein bar, which is loaded with sugar, like a macro bar. And then her blood sugar goes up, so she becomes hyperglycemic, and then it's this roller coaster, and then you tend to get anxiety, and you're stressed out, and you can't sleep because your hormones are off, because insulin plays a huge role too in thyroid production. So when you're not eating enough, your thyroid decreases. So just making sure that you're eating enough and timing it with your workout. So you're not having protein all in one sitting. It needs to be, studies show that it's best throughout the day.
Right. To have little bits of protein, small meals, whatever, especially as an athlete.
Yes. And 30 to 50 grams, I tell women. So my mother is around 70. No, she's late 70. She's like 78. Sorry.
That's okay.
Yeah, and she needs to have a lot more protein than she's having just to maintain muscle mass, because you're losing muscle mass at a faster rate beyond 40 years old.
Yeah.
So when somebody comes to see you,
Uh-huh.
what the first thing you do was I think you said something about seeing whether they were anemic or not. But what sort of blood panel do you do in evaluating them as a baseline?
So I have a blood panel that I put together for females. It depends on how much money they have, because it doesn't go through insurance. But it's around $200, and it tests for thyroid, so thyroid conversion.
Yeah.
It also tests for, it's a CBC, complete blood count, and then CMP, and then there's ferritin, which is your storage form of iron, because I found a lot of older women are not eating enough protein, and they're in that go state, so they're not absorbing it. So testing for iron, because iron is needed for thyroid to work. And then I also test for blood sugar and fasting insulin, because fasting insulin goes up before blood sugar does.
Yeah.
What else do I test? Homocysteine, to see if their methylation cycles work, to see if they have enough B vitamins and their whole cellular process is working and they're getting enough energy. And then I also have CRP on there for inflammation.
Yeah.
Gosh, I think that's about it. I think those basic ones.
Great.
Glucose, which is in the panel. Yeah.
Yeah. Really pretty similar to what we do. Before we have a patient, let's just say a new patient coming in, most of the new patients I see are coming in for hormone replacement therapy. So I want to see what everything's doing at that point. And so we just worked out a panel that's very similar to what you're describing and doing the hormone evaluations. I think we talked about the Dutch test.
Yes.
I've always looked at blood levels. That's what I'm used to, what I like to how I like to adjust things. And then the difficult patients are the perimenopausal patients, because they're all over the place. And in lots of ways.
Yeah.
Yes. Yes. And they're all different.
Yeah, absolutely. It's strange. I mean, somebody's truly menopausal, okay, that officially menopausal. Those are easy patients to deal with from my perspective. And so it's very interesting that you're looking at the same things that I am looking at. I'm looking at it as general risk benefit ratio, as there are some problem in them having hormone replacement therapy, but picking up other things that way, and also just the seeing what their FSH is doing and the follicular stimulating hormone, because that's the crucial part to what I'm doing with them, to see where they are first of all in the whole sequence of things. So, but you're asking a lot of questions to these patients, and do you give them paperwork to do before they come in? So,
Oh, yes.
okay,
Yes.
Okay, lots of stuff.
Yeah, and I spend 90 minutes with them the first time they come in to get a little bit of history. How long have you been vegan or vegetarian? I had endometriosis, and I had to have my, a couple of operations. And so that tells me estrogen dominant. So you give some herbs to help balance out the estrogen progesterone. Then there's also the stool test to see if they have high, something called beta glucuronidase levels, which keeps estrogen around a little bit longer. So you want to make sure they take a nutritional supplement to help bring that down, and then fix the gut so they're not reabsorbing the estrogen.
So you're using probiotics for fixing
probiotics
the gut,
or calcium D-glucarate to help with the beta glucuronidase levels come down, so they're not reabsorbing the estrogen. So then they're more of an imbalance. That's what I found with a lot of perimenopausal. It's just the higher estrogen, or they're not detoxing it. So the Dutch test is helpful for that, because it breaks down the different pathways of estrogen and how is their methylation.
Wait, what's the Dutch test? Is that saliva?
Urine.
Or urine. Okay, urine is the Dutch test.
Yeah.
It's a dried urine.
Oh, the dried urine.
Yes.
Okay.
Yes.
And then that will show if people are getting rid of or detoxing the estrogen or not. That's the test.
It shows a lot of different things. So yes, but it does show that. So that's great, because it looks at the pathways.
Is
So
that
how
the
it's
only thing that shows that? The only test? that
no,
shows-
there's
okay.
other tests.
Okay.
Genova has one, Endo
Yeah.
3+, which I looked at, which also combines thyroid and something else I can't remember. But yeah, it looks at a whole. Maybe it's inflammation. I ran that on somebody, but the Dutch I know a little bit
Yeah.
better.
Mm-hmm.
Yeah. You're used to using that one.
I'm used to
Good.
using that
Right.
one. Yeah. So looking at all those pieces help.
What I have found with the perimenopausal patients is that I see this as a difficult time because it's so irregular. They are the ovaries are misfiring a lot of the time, and so they can go through a couple of cycles, normal menstrual cycles, and then they have one that's not. They have irregular bleeding, or they have a lot of symptoms, or they have very heavy bleeding or none, and they and their hormones, the self-producing hormones have dropped out. The estrogen is actually fairly high at that point. Progesterone's not existent because they haven't ovulated. And I've found myself giving a little bit of estrogen to a lot of these patients because I see that their symptoms are, at least in my interpretation, are because of a lower estrogen. Their FSH is creeping up. They're starting to get the pituitary trying to stimulate things, get the ovaries working harder, and they're not. And I've had actually patients come back and say, "Oh, my doctor told me that my primary care doctor said that if I'm taking estrogen, I've got to be taking progesterone as well." Well, yeah, that's true, but if you're ovulating, you're already producing your own progesterone, and so it's okay. We've got you on a really low dose of estrogen. There's no danger in this. Once you're not producing progesterone yourself, then there's more cause for concern and supplementing the progesterone. Do you prescribe hormone replacement therapy?
No, I'm not
Okay.
able to do that. Mm-mm.
Okay.
I use herbs.
Okay.
Herbs to fix the blood sugar.
Mhm.
Weight loss is huge.
Yeah.
I find that the more overweight they are, the more symptoms they have.
Yeah, absolutely.
So yeah, that's huge. Learning what to eat after that and learning how to exercise at that point in time, because your body's completely changing, I think helps.
Yeah.
But yeah, I went through it myself.
Mm-hmm.
I'm still going through it. I'm perimenopausal.
Okay.
But it's few and far between. So I like that. But I've been taking a couple of adaptogens really help.
Mhm.
So there's this product called Feminescence.
Okay. Tell me more about that.
Feminescence is a specific type of maca. So the maca that you see in the stores are more for men and energy and vitality. And there's several, I think there's 13, there might be more phenotypes of maca. So phenotype, for everybody that doesn't know, is like we're both female and you have brown hair, I have red hair, that's our phenotype. I have blue eyes, you have brown eyes, that's the different phenotype, but we're both female. So there's several different phenotypes, and this company has packaged them and done a lot of research. There's a lot of clinical or trials on it, or published studies on how certain types of maca, one is for maca peri, one is for post-menopause, and one is for pre-menopause. So when they're having regular cycles. And I found that really helps. I've had women get pregnant on that maca. And then the perimenopause helps with the hot flashes. Yeah, because it works with the whole HPATG axis. So hypothalamus, pituitary, adrenal, thyroid, gonads. So I take that, and I also started taking a new one, and it's rhubarb, but it's a mixture of a couple of different herbs just to see if it would help me. And I haven't had any hot flashes or anything. That was my main concern, were like hot flashes. But I noticed adaptogens really, really help. So the more stressed out you are, over 40, they tend to have, there's a lot going on, and you have kids, and then the holidays, and you got to work, and you have to make dinner and shop and clean. And so it's
too much.
It gets stressful. So those herbs, the adaptogens, which help adapt your body to stress, so they could either decrease stress or increase stress if you need to.
Do you have a company you like to work with, or do you just get them at locally at a store? Or
No, there's a couple of companies that I really like.
Okay.
Metagenics is one.
Mhm. Yeah,
They
we
have some
use
good
them a lot.
products.
Right.
Yeah, there's a couple through that. Yeah, I've tried a bunch of different for me to see what works. And then the different adaptogens like rhodiola helps give you more energy. Ashwagandha calms you, which also helps with thyroid. So it's all about regulating that whole hypothalamus pituitary adrenal axis.
So when you do your 90-minute intake, you've got the paperwork done, you've got a lot of information about them, you've done the lab work, you make recommendations to them. How frequently do you see them after that?
So I like to see them like 3 to 4 weeks, just to make sure. It takes time to make changes, and be held accountable really helps. So I find it takes, on average, it takes a year to stick with that change. So there's actually a couple of studies on it, and I learned it way back in graduate school. And it's 3 months to think about the change, 6 months to make the change, and 9 months to actually start doing the change, and a year to stick with it.
Yeah.
So
where it becomes just a habit.
a habit, exactly.
Yeah, right.
Yeah.
Changing
So
a habit.
yes, the habit.
So you just and then you're largely looking at the 3 or 4 weeks and seeing that they're going through and they're doing the right thing and get to that point of developing a habit to do it. Do you see your clients once a year, or they come back for a checkup every so often? Or
Yeah, so each
whatever?
client is different depending on how much they have going on. I like to see them for like 3 to 4 months, like pretty consistent, just to make changes. And it also takes 3 months to make changes at the biochemical level. So if they have like gut issues going on, that would take a lot longer if they have. Yeah. So, and osteopenia, that's going to take a lot longer. And I had somebody recently with an ulcer. So she wasn't able to absorb things. So if they come in with those sorts of things, then it's going to take longer. 3 sessions is not going to cut it. But it really depends on that person.
Do you have the patients that you're seeing, the clients that you're seeing are athletes? They're being somewhat competitive either with themselves or officially competitive. What is there any? Is there a frequent question that they have relative to longevity? Is that one of their major concerns or not? Or a lot of them, a few of them, or are they concerned about growing old healthfully as opposed to just concentrating on their performance?
Yes, I would say yes.
Okay.
Yes. And I make that a point to talk with them about that.
Okay.
So for instance, I have a trail runner who has osteopenia, stepped in a hole, fractured her ankle. It wasn't healing, and she went to get the bone density. I think we spoke about this before, and it turns out she has osteopenia. So she wants to know, her main focus right now is, how do I get back to running?
Yeah.
So versus I have other athletes where I just want to feel good. I just want to, I want to get over my ulcer, and I want to know that I'm eating properly, and I haven't had any labs done since I was at 10 years old. And so everybody's different, but yes, some of them, I talk to them about longevity, and I give them examples, like for instance, the bone health. And I get a lot of older women, like I'd say 70 plus, referred from an endodontist because their teeth are falling out.
You said that.
Yeah. So that's something that you don't think about with osteoporosis or osteopenia, that your teeth are, held in by your bones.
That's terrifying.
Yeah. So that's important too. So I bring that up because we don't think about that. And then when I get those older women, they're on stomach acid reducing medication. So that reduces your ability to absorb calcium, zinc, magnesium, iron, all of those things that are needed for your metabolism to run and for bone health.
Yeah.
Wait, I have a question.
Go ahead.
So with, how just all the talk of menopause and menopausal medicine right now is just crazy, right? With all the information out there. I've seen a few videos from the special that was done on PBS, the M Factor. And there were some people in there saying that as we get older and we go through menopause, that extreme fitness is not recommended for people, for women.
They're doing exercising too much.
They're exercising too much.
Yes.
What do you think about that? I want to like really go more into that, or what your thoughts are about it. So, and what that looks like.
Mm-hmm.
You know, what if that person is, what they're doing, how much are they exercising? What should they be doing if they're a fit person?
Yeah. So one of the key things that I see women doing is over exercising. But if they want to over exercise and they have to because they're doing a trail race or they're doing Ironman or something like that, then yes, but that's great. We need to exercise, but let's take more rest days and make sure that your nutrient timing is on par and making sure you're sleeping and your cortisol isn't through the roof. And if you need adaptogens, take adaptogens. So yeah, you become more catabolic if you're over exercising, especially females, because as you hit menopause, your cortisol goes up just naturally. Mm-hmm. And so you're going to be in that catabolic state and break things down. So it's best to have more rest days. So I just had a new client the other day who's having trouble losing weight, and she exercises a lot and doesn't eat before she exercises. Well, that's just decreasing your thyroid hormone production, increasing cortisol, packing on the belly fat. And so your metabolism isn't worked, and you have to fix blood sugar and all that and eat before you exercise in order to lose weight. That's the way your metabolism works.
Mm-hmm. So people really mess up their metabolism.
Yes. Yes.
So you're probably doing a lot of fixing.
Yes. Mm-hmm.
Yeah.
And helping them understand what they need to do, because there's, you go on Google and you listen to the podcast, and only 6% of the sports science studies out there are done on females. So they're all done on like white 26-year-old males.
That's crazy. That's horrible.
Mm-hmm. Well, females are hard. It's complicated. It's costly because we have so many different hormones and they're all over the place. And yeah, so they're actually starting to do more. They're starting to do more studies on females. So there's new research coming out.
Yeah. Well, I mean, I think that it was just probably a year ago that I figured out that I needed to eat before I worked out. And it was from wearing the glucose monitor.
Oh, perfect. That's a great.
And so that was the best information that I got from wearing that.
You wore it for 48 hours.
Well, yeah, because I kept, my blood sugar never kind of does much, or it only dips. So, but I now whenever I'm going to work out or go for a long walk, I just eat,
Good. Because
a good amount of food. Probably the most food I eat in a day is before I work out.
That's great. And eat after you work out. So protein, like a protein shake. Mm-hmm. And creatine is really good too.
How do people take creatine?
Yeah.
Is it a supplement?
Yes. It's a powder, but there's a lot of studies that it helps with sleep. It helps with females, like bone. It helps with growth hormone.
Do Metagenics have that?
Yeah, every health food store in town.
Okay.
Has
yeah, exactly.
And I know, but I'm doing an order for you.
Thorn is a good one. It's NSF certified, which means that Thorn and Designs for Health has Designs for Sport, but but I like Thorn creatine.
Okay.
And so it's creatine monohydrate, which is the most studies are done on that. And it's 5 grams once a day, either before or after you work out. It helps rebuild. So, and it takes 30 days for you to fully saturate your system with it.
Yeah. Because those are, when I was hearing this information on the PBS special, I was thinking that's probably the biggest change I've noticed with going through menopause. I've been on hormone replacement therapy, so it wasn't anything difficult for me. But the main thing I noticed was how I was feeling surrounding food, what I was eating and working out. The huge changes.
Yeah.
Yeah.
Yes. And there's a difference between cardio and strength training too. So you want more carbs when you do cardio and a little bit of protein as well. So not just carbs like we've always been told. And then strength training, you want more protein and a little bit less carbs because you're working the muscle. So
Good scoop.
so yeah, it's the nutrient timing surrounding
Yeah.
the workouts.
What about intermittent fasting?
So I've found there's a lot of studies that say that's not good for females. It's more, it's better for males because females are meant to support a baby. And so when we go into intermittent fasting, our thyroid levels slow down because we're meant to conserve fuel because we have a growing child inside of us versus men. They do better with intermittent fasting because they don't have that. They don't have a child growing inside of them.
Right.
Women need to eat sooner after exercise. Men can wait like 3 hours and it won't interact with their metabolism. Women should eat within like 30 minutes to an hour after exercise because that's when we're going to absorb more of the nutrients and rebuild our muscles. So women and men are just different.
Yes.
But that makes sense.
Obviously.
That just makes sense that women and men would be different with those things, I think.
Yeah. And then estrogen and progesterone. So my colleague and I are coming out with this course for premenopausal women athletes and estrogen and progesterone at different phases, like the luteal and follicular phase. So progesterone breaks down, breaks down muscle. So you want more protein in the progesterone phase. And there's different phases where you could actually have more protein and carbs to support that inflammatory activity. So it becomes more anti-inflammatory.
Have you ever heard of Susie Wiley? Have you ever heard her name? She's an author. She's a crazy lady. She used to live in Santa
She's
Barbara.
not a crazy.
Oh, okay.
She's crazy
no, I haven't heard.
passionate about what she does is what she is.
She is. She thinks outside the box.
Okay.
She's remarkable. She's great. She wrote a book called Sex, Lies, and Menopause.
Oh, I've heard about that. Okay. Yes.
And what she tried to do it's a great theory. And it was very popular about 20 years ago here in Santa Barbara because she was here then. And what she did was try to work out a hormone replacement program that would mimic the menstrual cycle. So there would be, for the first 14 days of a 28-day cycle that she was pushing people into, was slowly building up estrogen to peak at 14 days and then gradually coming down.
Is that the Wiley protocol?
Yes.
Okay. Then yes, I'm familiar with that.
Right.
You
Okay.
might have patients that
I do.
use the Wiley protocol.
Yes.
Yeah.
It should work for everybody, and I don't know why it doesn't, but it doesn't. And so it's not really very popular now. And a lot of the reason for the lack of popularity is if you did it Susie's way, she would say you have to have a real period once every 28 days. And a lot of women didn't want to do that again. So
I don't blame them.
No.
yeah, really. So that, as you were talking about, you're developing a plan of replacing hormones and diet in association with that, with the hormonal supplements that they're on and the timing that they're doing. There are some benefits in terms of fighting cancer, of having that high level of protein for part of the time, and the preemptive estrogen peak prior to it. But most hormone replacement therapy is done on a standard static basis because that's what patients generally feel better doing. Not sure that it's the healthiest way to do it, but it's certainly the most easiest to manage, because one of the real problems we deal with hormone replacement therapy is abnormal or irregular bleeding.
Yeah.
And although that's almost always just nuisance value, it's big nuisance. And it's also bleeding maybe the first sign of some intrauterine problem of endometrial cancer. And so you've got to always work up on those and do blood levels and ultrasounds and biopsies, so on. So to those that knew it was Susie, but T.S. Wiley was the name that she used as she was writing.
Yeah, I have a couple of clients on the Wiley protocol, one in particular.
Right.
Yes.
So it's so complex. It's, I really try hard to keep it simple, but I'm failing. But I do feel like trying to keep it simple is of overall benefit, because you can just confuse things and give the hormones in the wrong levels, not associated with each other. It's certainly a transdermal method of absorption is the way to go. It's the safest way to go for almost all patients. But it's complicated and it's intriguing, because I went into OBGYN 50 years ago, and I did it because it was fun. Yeah. OB was great, but there was enough blood and thunder to keep you excited at times, but there was a lot of physiology involved with it, and some surgery, and I love doing surgery. So, but then when the OB came out of it, because I really didn't want to do anymore. I was tired of that and the nights and so on. But gynecology changed. It just seemed like it changed for me, because there was always something exciting that was happening along the way, whether it was minimally invasive surgery, and then particularly getting into the hormones, because my patients have grown older with me, and they've gone through menopause. I've gone through menopause with them, and so it's been a learning experience, but it's still a happy specialty, because we're making people feel happy.
Exactly. Yeah.
They're healthy and they're happier, and so it's of great benefit. One of the concerns that I have, we were talking about over-exercising a little earlier, but I'm wondering, have you ever heard of an association between over-exercise and motor neuron disease? Has that ever crossed the pathway at all?
Not yet.
Okay.
I have a question though about you, because you are are you still competing with sports, or do you still?
Not really.
No,
I compete with myself and my husband, but
no. What do you do? What type of fitness do you do right now?
So my background is I did triathlons a lot.
Mm-hmm.
I did marathons. I did ultra trail runs, a lot of exercising. And that's when I actually took hormone replacement therapy in my 30s. I was just feeling so fatigued and worn down when I was training for half Ironman in Hawaii. And so I went to see somebody, and she put me on estrogen and progesterone, transdermal. And so I thought, God, this just doesn't feel right. It's a little off. Oh, and testosterone, because I was pretty low.
Yeah.
And then that's when I first wanted to start getting into nutrition, and I worked on my body. I got off of that stuff. And now I don't work out like that anymore. I learned what I need from my body. I work a lot. So right now I surf a lot. I ski because it's the season right now. And I lift weights. So I would love to do some running races. I just don't have the time anymore. But shorter distance, I don't think I could do like a full Ironman. I could, but I wouldn't like it right now. Or a half Ironman. I could do a half Iron marathon. But
you're doing primarily like day to day. You're in the gym or whatever, doing weights.
Yeah, so I try to do it 2 to 3 times a week. But realistically, yes, I did a leg workout the other day for skiing, and it just about killed me because I hadn't been doing it for a while because I love to ski. And then surf. There's been a lot of surf lately, so I'll go out surfing, and I do a lot. Oh, here's another thing of mobility. So mobility meaning stretching and so yoga-esque, but really just so mobility. Moving, like before I get in the water for surfing, it's a lot of popping up. So bringing your legs underneath you and doing like a pigeon, for instance. So yoga would really help with that. That's why yoga and surfing, I think, are so, there's a lot of surf retreats.
Yeah.
So that's super important as you get older too, because I get a lot of women with aches and pains and arthritis. And I'm not sure if you've heard of foundation training.
Yeah.
Oh, okay. Eric Goodman.
Yeah.
Yeah. So I have a couple of women that are like in their 50s. I'm thinking of one in particular. She's vegan and she had endometriosis. She had both of her ovaries removed. So she was in menopause in her early 20s.
Oh gosh.
And so she's overweight. She has a lot of joint pain. And I told her about foundation training. And so she started doing that. And she said, gosh, my glutes and the whole posterior chain. So from the upper back down through the glutes were engaged, and she had lost that ability to do that. And so I find that strengthening things like that, then you take the pressure off the little muscles and the tendons and ligaments, and then you have less joint pain, you have less inflammation, you're happier, which makes a huge difference. And so you're able to move more, you eat better. It's all just a snowball effect.
And what sources of protein do you do? What are your go-tos?
Oh, well, I love animal protein. I tried to be vegetarian. I just couldn't do it. I need animal meat. I need it for the iron. So I know when, if my cycle's going, I crave, red meat for the iron. And fish, I eat a lot of fish.
Do you do the protein powders and bars and stuff like that?
I had it for breakfast this morning. I had some quinoa with I wanted to try this hazelnut milk, and I put some protein powder in there.
I saw the hazelnut milk yesterday at the market.
It's really good.
Is it good?
Yes.
What would you compare it to? Which nut milk?
Oh gosh, it's
similar?
different. It's so different than the rest.
Why? Is it thicker? Is it better?
No, just the taste.
The taste.
Yeah, but I got used to it. Sort of like almond milk, I guess.
Okay.
Yeah, it's good to have a variety and diversity and not.
Yeah.
I test for food sensitivities as well. If somebody wants to test for food sensitivities, because sometimes it's not as accurate as you would think. But just rotating your foods is good. So don't have the same food over and over again, like swap it out every 3 days or something like that, so you don't develop that immune sensitivity in your system and you don't get food sensitivities. So that's another little tip. Sorry, just to put that in there.
Oh no, that's good.
So I see people eating the same thing over and over. I'm like, switch it up. Have a different apple. Have Gala, have Granny Smith. So those all have different nutrients in it. Yeah, have different berries.
Okay.
Different nut butters. Don't have almond or peanut all the time. There's cashew. There's mac nut butter is really good. Sunflower seeds have choline in it.
What's mac nut?
Oh, macadamia nut.
Oh, macadamia.
Yes.
Oh, wow. I don't think I've even seen that.
Oh, that's really
in the
good.
market.
Yeah, that's a good one.
Okay.
I haven't seen it recently either, but I got it once from Costco.
Well, my daughter called me yesterday about this thing that's trending on her social media called coconut cult. Have you heard of that?
Yeah.
What's that all about?
That's like a coconut-based yogurt.
Yeah.
Yeah, it's really thick. It's really good. They have a chocolate one, a strawberry one.
Yeah. She's saying it fixes your gut.
Well, that's what the marketing says.
She was driving all over LA looking for it. I'm like,
oh, yeah, I think they're out because they used to sell it at Lazy Acres, and I don't think they have it anymore. But then I have seen people that you eat too much coconut and they become sensitive to it. So everything has coconut in it now.
Yeah.
So the more you eat of that, sometimes, if you have intestinal permeability, that you could become sensitive to that. Just to mix it up a little.
That's good.
You've heard of Peter Attia. He's basically had this description of the 4 horsemen of cancer, metabolic disease, brain disease, and atherosclerosis and diabetes. I think one other name needs to be attached to that 4 horsemen. It should be 5, and that being osteoporosis, because this is a huge problem. Most people have, a normal DEXA bone density study, almost all of our patients shows some osteopenia, if not osteoporosis. So it's going that way unless you do something significant about it. There's a company in town called, the mechanism they use to evaluate, they have a new test for bone hardness, and it's called a bone score. And it was developed, a test that was developed at UCSB. It's now being adopted by the Mayo Clinic in terms of testing people, and it's something you can, it's a direct look at the hardness of the bone as opposed to the density on x-ray. And it's now has a better correlation with fragility than the DEXA. Basically the question was, do you know about it? It's really a great test. There are only 3 places in town that do it. There's a concierge physician, Alan Viglione, Alta Orthopedics, and us. We do it in our office, and I've been associated with known about this, the research on this for about 3 or 4 years now, but it sort of slowed down over COVID. It got FDA approved as a test, but it's not covered by insurance, and it's kind of expensive. It's $450, but it can really show the severity, the risk involved, and if you are doing some treatment for it, whether it's exercise or nutritional or medication, you can see a difference in a few months, which you can't with a DEXA. So just something to know about. It's fascinating, and it's got it. The reason why we have it in our office is because we're in Santa Barbara.
Well, it's interesting because some people have a pretty devastating DEXA, and then their bone score isn't that bad. So having both pieces of information is.
Yeah.
Do you do both DEXA and bone score?
Mm-hmm. Yeah.
Okay.
Well, we order the DEXA.
Yeah, we order the DEXA. It's covered by insurance for almost everybody. So, and I will do the bone score if the DEXA is bad, and I want to just see how bad is it. You know, is this a serious issue for this particular patient, or for some people that are just more worried about it. They are involved in exercises or activities that put them at risk, like, you know, hiking and rock climbing and horseback riding and things that if they have an accident, you know, we don't bounce so much or bend so much as we get older, we break, and it can be a huge problem. It's looked at. I don't think it's taken seriously enough. The osteoporosis.
I agree. I'm becoming more aware of it.
What do you think in terms of a dietary regime for that? What type of magnesium and calcium and phosphorus, and do you have some thoughts on that?
Yeah, so optimizing their digestion first to make sure they're absorbing it. So if they have low stomach acid, or they're taking proton pump inhibitors or acid lowering medications, so they're not producing stomach acid to absorb it, that would be the number one. Making sure that they're not so stressed out. So addressing their stress levels, because then you're in that fight or flight that breaks down bone density. And then you're not producing stomach acid because you're running from that lion, and your stomach says, or your body says, God, well, I'm not going to have food right now. Let's send all of our blood and everything to our extremities, dilate our eyes, increase our blood pressure, increase our blood sugar to run from that lion. So you're not going to absorb it if you're in that constant fight or flight, constant go, go, go. And then also there's telling them which foods help. So optimizing their thyroid function, because thyroid is linked to, helps with bone density. Right. So fixing all of that. And then there's also a supplement that I've really started liking. It's called Algacal.
Okay.
I don't know if you've heard of it.
I haven't.
So it comes from algae. So it's it's highly bioavailable in our body. And they have all in that. They have clinical studies saying that it can reduce or reverse osteopenia and osteoporosis. Yeah. Okay. So I've been using that with my clients. They have different, that's all they do. So, and it has Algacal, Algaeacal. And they have Algacal Plus, and then they have strontium and boron, and they have a lot of other different minerals, which I think we're not getting. So everybody gets protein, carbs, and fat, but we're not getting the minerals needed. And that's what we're lacking. We're mineral deficient, not macro deficient. So it's the minerals. So working with them on diet, which foods are high calcium, making sure they're absorbing it, or vitamin D. Vitamin D is really hard to get. So optimizing the vitamin D level. And I think the vitamin D level should be higher than the standard range that they say, which is different for every lab. But I think the higher, higher than the normal. They're not 30 is not normal.
30, no, right.
30 to 100 is not. I like a tighter range, especially higher.
Right.
So if they're
Absolutely.
if they're trying to maintain bone and making sure that their vitamin D levels are high, and then there's the magnesium, which is depleted more rapidly when you have higher stress levels. So the stress is huge. That's one thing that I really
And
look
which
at.
of the magnesium compounds do you recommend? Do you think are best absorbed? Because magnesium is extremely important, but if you get it in the wrong method, it can cause more problems or just inconveniences.
Yeah. I like glycinate. Glycinate's really good.
Okay.
Sometimes there's a combo of like malate for the mitochondria, because magnesiums are really, really unstable. So you'll never see magnesium by itself. It's always attached to something. So magnesium oxide, if you're constipated, magnesium citrate is highly absorbed. I also use that. If you take too much, it acts as a laxative as well.
Right.
Magnesium glycinate's attached to glycine, which glycine is like a nice calming neurotransmitter. It's like having a nice glass of red wine. It calms your brain down. And a lot of people are deficient in that. It comes from animal meats, and you have to be absorbing it, eating enough meat. And it also helps with the detox pathway by producing the master antioxidant glutathione. So glycine, I find when I test, is a lot of people are low in that. Plus glyphosate attaches to that receptor in our body and replaces the glycine. So if you're not eating organic, or you have a lot of pesticides and herbicides that are used around you, or you're exposed to that, then you probably need more glycine. So
how many supplements do you take a day?
I think it depends. I don't take any bone enhancing nutrients. I probably should after this conversation. I don't know, probably like, I'm always testing out new supplements.
Yeah, that's good.
So, and I'm always testing new things like neurotransmitters, zinc. So I have like a B complex I take. B complex is super important for everything. So not just B12 or folate, but all the B vitamins. B complex, vitamin C, vitamin D with K. Then I take a couple of adaptogens. The maca that I was talking about, and I'm testing that other one out with the rhubarb in it. So
that's good.
I test all these things.
Rhubarb had to be good for something.
Yes, exactly. Yeah. So I'd say probably 10, I guess, give or take. I'm not that dedicated because I know my levels I test, but it depends on how I feel, or it's all dependent if I'm experiencing a lot of stress, or if I can't sleep, I'll take more adaptogens. If I don't need it that day, I'm not tired, I won't take adaptogens. If I've had a heavy workout, I'll take creatine. I take collagen. That's super important for the bone density as well.
I was going to ask you about collagen, what your thoughts were on collagen.
I love collagen. There's more studies coming out, not just for skin and hair and nails, but also for bone density. So the trail runner that I had mentioned earlier, I put her on collagen and have her take it. I did see a couple of studies that when you put it in coffee, it degrades it. So I asked them not to put the collagen in coffee or caffeine. So I take collagen to help with, I combine the collagen and creatine to make sure I'm getting that. And if they're vegan, vegetarian, they're not getting collagen. And we used to get collagen like when we had bone broths and soups and we ate chicken off the bone. But now we have skinless, boneless. So we're not getting the collagen anymore.
Not in our house.
Good. Not at our house either.
We're eating chicken off the bone.
Oh, good.
Yeah.
There's your collagen.
Picking at the carcass.
Perfect.
And the skin you leave behind that I just eat.
Yeah.
So.
You're getting a lot of collagen then.
Yeah. Gosh.
Well, we have to do her fun fact because it's very fun.
Well, yes. Your fun fact.
She was in a breakdance.
Breakdancing.
Oh,
So-
I forgot what I put. Yes.
So there must be more fun facts about you, but we don't need to go into that. So do you feel like the Olympics were just a little too late for you in the breakdancing, that you can't compete in the Olympics?
I know. Yes, I do. I do.
Yeah, really should have happened, shouldn't it?
Yeah.
But maybe
exactly. Maybe. Yeah. It's never too late.
Yeah, it's really fascinating.
Yeah, I was
But I
pretty
know-
active.
Yeah. There were some stories about the breakdancing in the Olympics, though. A particular Australian woman, competitor, who did something. I didn't ever see her performance, but she just got slammed online.
Oh, yeah.
And I mean, just hate mail.
People are so mean.
And we got to take hate out of the diet.
Yeah.
completely.
Yeah.
It's just-
Oh, well, that would elevate your cortisol or your stress to
Yeah.
get that. Yeah.
It was amazing. But I was just thinking, yeah, you may have missed the boat on that, but maybe you did. They can still do it. You can still do it. I'm getting back a little bit to the longevity issue, because I feel that there are very few things that we know really keep us healthy longer, whether that means actually living longer or just living healthily longer. Exercise is always there, and it's the only thing that's really been shown to increase longevity, and so there's a lot of more emphasis in people that are interested in that, and then longevity is, there are places popping up all over town that are specializing in longevity, so there's the interest, and we want to be directing in the right way. And I think that overexercise is a problem. But I think, I guess I'm looking at it as being, it seems to me the amount of exercise one has to do to do it perfectly is a lot of time on a daily or weekly basis. What do you think about high intensity interval training as part of it? I hate exercise. Okay, I love sports. I love.
He's wanting you to tell him he doesn't need to exercise.
Really? And so the type of exercise that I hate, weights are fine. Okay, that's kind of fun because it's quick and relatively easy. I hate running, although I can't run anymore because I had some nerve damage from a medical procedure. Being on an exercise bike or a treadmill or elliptical or anything, that's worse than death. So can high intensity interval training take the place of that 5 hours a week of cardio?
Yes. High intensity hit or sit sprint interval training, which is shorter for higher periods. Yes, those are great for you, but only like 2 or 3 times per week. You don't need a lot of it. And they're quick workouts. there's an app that you can download, 7-minute app.
Yeah. Okay.
Yeah.
Have you done that?
Yeah.
That's perfect. It's 7 minutes.
We
He
had
loves
this.
that app because it's 7 minutes.
Yeah, that's perfect.
Yeah.
That's perfect. And it's really anything that you will do. And weights are great. That's really important as you get older.
I think people just obsess too much. Like, just get up and move. Like, you could
Just
do
move.
just basic calisthenics, like jumping jacks, push-ups, squats, lunges.
Skipping. My husband.
Skipping,
Wow.
rope,
Yes,
jumping rope.
yes. My husband owns a gym here in town, Dopamine FX, and he works with older females, and he helps them with balancing exercise and skipping. He has them skip because if you look at if you look at older people, like
I get it.
Joe Biden is a good example. I didn't want to say his name, but I just saw a video the other day of him almost tripping, and that's not getting that sprint, that quick, fast twitch muscle fibers, and so he could fall and break a hip. But so working on that, like skipping or jump rope, is really, really good for that quick
So what's your husband's business? What gym is it?
dopamine at Functional Health, Dopamine FX.
Okay. And I have it's all about me. Okay. That's the advice I want. I don't really mean that seriously, but I do want, I had S1 damage from a steroid epidural injection in my back to relieve back pain. Didn't work for the back pain, and it damaged my right S1. And so my balance is questionable. And because my proprioception isn't quite as good. And so I'm kind of looking for some help on that physical education. So it sounds like I should talk to him. Yeah.
The balance is crucial as you get older. Right. I was just looking at a study the other day, and it was talking about as you get older, like 60 plus or whatever it is, you have to incorporate balance because you lose it as you get older. And plus your strength training and standing on one leg. How many people can do that? You think you can, but even I have like, whoa, after 30 seconds and to close your eyes and do that, it gets worse as you get older. So just retraining the brain.
I've noticed it lately, just I'll be sitting down and I'll get up. I won't even be thinking about like, am I going to lose my balance? And I'm like, whoa, I just leaned over. Anybody watching would think I've had too much to drink, because of the way I
you don't realize.
Got up off my chair. But it's interesting. Yeah,
so the balance is, but the HIIT interval training is great.
Great.
That's
Thank
great.
you for that.
Yes. It increases testosterone, human growth hormone. It helps with insulin. So it's great for females too. There's more studies coming out that for females, that's what I recommend. Strength training and HIIT, and it's so easy to do that. High intensity interval training.
Yeah.
I do that too, and I use the rowing machine in there for the 10 minutes.
We have a small workout in our garage. One car gets in the garage, the other one doesn't. We have things that we work on there. It's great. Thank you so much for your knowledge and your wisdom. It's been really interesting to talk to you.
Oh, thank you. Thanks for having me.
Well, thanks for listening. We're getting really good feedback. We'd really appreciate a review on Apple Podcast, Spotify, or wherever you're listening. Thank you. You can always DM the Vagina Doctor Instagram with any questions or topics you'd like to learn more about, or email us. The Vagina Doctor Podcast. It all starts here.